So, what does success mean in IVF, sir?
That's a very big question and a very good question, because everyone talks about success everywhere, and we normally compare, even as a patient, we also compare the different success rates, but nobody knows what we are talking about really. And I think it's very important to be very specific about what we are measuring and to be very professional on that also. Because we can just be focused on doing embryo transfers for the patients, so all of them have a transfer and they are happy, but we need to be focused on results end of the day. So success rates should be linked to any indicator which is clinical. So at least we should measure pregnancy rates. That should be the first step. But measuring just pregnancy rates is something very limited under my viewpoint. We have to measure also things like implantation rates, in which we are also measuring and seeing how efficient we are, how many embryos we need to get a pregnancy, not just to get a pregnancy, how many embryos we need to do that. Because if we are able to have pregnancies with fewer number of embryos, we can also transfer fewer number of embryos to avoid multiple pregnancies, for example. So multiple pregnancies will be also one of the indicators of excellence and success rates.
Okay.
And we can also measure ongoing pregnancy rates to see if the pregnancy is going well after the beta CG. We can also measure, obviously, live birth rates, which is the final goal, because at the end of the day, we need to have healthy babies and healthy mothers. And we need to have indicators about success on both aspects, about the baby and about the mother. Yeah.
So, what sets Ferty9 labs apart from the other fertility labs?
Again, that's a very good question, because there are many points. I have to summarize some of them. I will say that we have some aspects. One would be, first of all, about transparency, which I think is really critical and very important. One is about transparency. We are very transparent about the pricing for the patients, about what we do, and about the whole ethical setting we have for the patients and from the laboratory. All the information right from the beginning, all the possible expectations of the cycle. So transparency will be one of the points. The ethical practices will be also part of this transparency also. Second is about quality. We are very particular about quality, both about investment in the best equipment possible and best facilities for the air quality in the laboratory, for all the incubators and all the equipment, for safety also with these technologies like RI Witness and Siltrix, but also about the way we do things in the laboratory. Our SOPs, our standard operating procedures are also very particular and very specific with checking everything every single day. So we are absolutely sure that everything is working as it is supposed to be working according to our standards. And if there is any deviation, we have the right tools and the right information to correct it. So quality would be also one of the points. And finally, which I think is probably the most important one, is about the culture, the company culture. And I'm trying also to implement this in the laboratories, to have also the company culture within the laboratories with the staff, which has to do with allowing people to grow in the system, to flourish as embryologists in the system, to have a career growth in the system, to be trained properly, to have a culture in which people is happy. Because we have this hope to happiness as part of our DNA in the company, we need to translate this also into the laboratories and to the lab staff. And that's hard work to do, but it's a beautiful work to do also. So we are also working on leadership with our lab managers in the laboratories. We are also doing different activities also with them, so that people are comfortably working. There is a good working environment, and they want to stay with us, they want to work with us, and they are also proactive in the system because they feel comfortable. And this is pretty critical also for us.